So now we're on Learning Plan 10. So Learning Plan 10, 11, and 12 are the community-based learning plans for this course. So we are looking at assessing a community, including the relationships among individuals, groups, and health. Of course, you know me because I really love mental health and that's my specialty area. I will certainly try to throw in as much mental health as I possibly can as we're covering this content. So anyways, so in the Nysen McEwen Community Health book, we're looking at chapters 1, 6, 7, and 9. And those are covered in the following slides. And of course, I always have pretty much designated which slide is coming from which chapter and kind of do it in order so it helps you as far as you're studying and reviewing the chapters. So, chapter 1 is called a community view. And just starting out with a definition of a community, it's a collection of people who interact with one another and whose common interests or characteristics form the basis for a sense of unity and belonging. So I would bet most of you can probably relate to this on some level. Being part of perhaps a school community, you're part of the LTC community, you have a neighborhood that's also a place that you probably refer to as your community, perhaps the city or small town that you live in is your community. So we can have a lot of different communities, but basically we need to have that feeling of that sense of unity and belonging to call it a community. Public health nursing, just some other definitions. So the ANA definition of public health nursing is the practice of promoting and protecting the health of populations. So now instead of looking at the health of an individual person, which really we've been kind of probably in most of your courses up till now, you're really more thinking about the individual, possibly including the family also. But I would think most of the content that you've had so far in nursing is really related to a small group, perhaps even like a family or an individual. So now we're thinking about an entire community. So same nursing process, just a little bit of a different focus. So it uses knowledge from nursing as well as social and public health sciences to promote and protect the health of populations. And it's, again, population focused with the goals of promoting health and preventing disease and disability for all people. Community health nursing, the ANA definition, is the synthesis, so kind of like combination blending of nursing practice and public health to promote and preserve the health of populations. So again, we're thinking about reaching out beyond the individual and family and looking at a larger group of people. So care is directed to individuals, families, and groups, so really all three are included, and it contributes to the health of the total population. So, and the book makes a specific mention that the terms public health nursing and community health nursing are used interchangeably in Nysen McEwen 7th edition, which is the edition we're using. So you might be thinking, all right then, is there really a difference between the two? You know, there might be some subtle differences, but I guess we won't have to rack our brains trying to differentiate that much between the two. And I'm certainly not going to ask you a test question asking you to differentiate between community health and public health. So we can just kind of get that right off our plate. So, definition and focus of public health and community health. Really, it's the science and art of preventing disease, prolonging life, but we don't just want to prolong life. We want to promote healthy life. So promoting health and efficiency through organized community effort. So community health extends the realm of public health to include organized efforts at the community level through both government and private efforts. So every community should have, well, I shouldn't say every community, every larger city, well, even cities the size of moderate-sized cities, Sheboygan, Manitowoc, are going to have their own public health department. A smaller community, such as the town of the town of Newton, perhaps the town of Sheboygan. What other towns are there? I don't know. Anyways, smaller communities, maybe Oostburg. I would doubt that they have their own public health department. I live in the town of Sheboygan. I know for sure we don't. So smaller communities don't have a public health department. However, a larger community usually would. And so but they would be covering a specific area surrounding them. So everybody should have access to a public health department. It just may not be, within an easy reach for some people. So community and public health nursing practice. So it really is kind of a neat opportunity for nurses to practice thinking about the larger impact of what we do, the larger, having a big impact on the health of an entire population. And I do think that that's what really drives people to work in areas like community health or public health. So it's really, we practice disease prevention and health promotion. The practice is very collaborative. You really can't work on your own. You have to work with community members and, of course, other disciplines in a community if you're really going to have an effective community-based program. So the practice is based on research and theory. So think about quality improvement, evidence-based practice, CUSIN principles are certainly evident here, and it applies the nursing process to the care of, again, individuals, families, aggregates, and the community at large. So an aggregate is basically a group that has similar characteristics, or at least they're drawn together by a similar purpose. So even nursing students at LTC would be an aggregate. You're all doing the same thing. You're all going through the same types of things in your life. Well, of course, obviously with differences, but you're all studying and working really hard and not getting much sleep and probably not paying much attention to your total health, perhaps because you're just really trying to get through your courses. So truly, you are an aggregate with many commonalities. So essential public health services. So really important things that public health does. They monitor health status of the community to identify and solve community health problems. So it's really interesting to think about what types of health problems we have in our communities. And I believe that you have a discussion question that kind of asks you to look at what type of health issues are you having in your community. A few years ago, we actually had an outbreak of tuberculosis in Sheboygan. So that was a huge issue that the public health department had to work with and deal with, because you certainly don't want that outbreak to extend itself throughout the community and have multiple people. It was apparently an immigrant family, and it was a very large family, and they had a great deal of trouble trying to keep people separated from other people so that they wouldn't spread this illness. So it really is interesting to look at what is going on in your community currently. So they diagnose and investigate health problems and health hazards in the community. They inform, educate, and empower people about health issues. Certainly, education is a form of empowerment. If people have knowledge, then they're able to, you hope, make their own decisions and make really good decisions about their own health. It is not a guarantee, however. So because we educate somebody, and you probably know this already just from being a student, working in a hospital setting or having clinical, because you encourage somebody and teach something, a particular thing that's going to improve their health, doesn't necessarily mean they always do it. But it does empower people to give them that knowledge, so hopefully they will be able to follow through. So that's an important thing that we have to think about. We can't make people make changes in their lives, but we certainly can empower them by giving the information that they need. Another public health service would be mobilizing community partnerships and actions to identify and solve health problems. A really good example of this in Sheboygan, we had a heroin committee that was kind of a multidisciplinary committee. We haven't been meeting now for quite a while, but it was very interesting. I attended many meetings. It was public health nurses, people in the community like police officers, pastors, social workers, counselors. It was just such an interesting group of people. And actually, even some people, just concerned community members, also would come to those meetings. And we used that partnership to try to deal with the heroin crisis that was going on in our community. And they really came up with some excellent ideas, and I know that some of those ideas were put into practice, such as having a drug court to get people into treatment rather than just putting a user into jail, somebody who's a drug user into jail. Very different from having somebody who is selling drugs. That would be handled a little bit differently. But if somebody is addicted and using substances, they were really trying to get them into help rather than throwing them into jail. And I know that was specifically something that occurred because of those meetings. So when you get people together and you identify and you solve problems, you really can make some momentum in a community. I actually haven't heard anything about that drug court recently, so I'm hoping that it is still ongoing. Anyways, so another essential function is developing policies and plans that support individual and community health efforts. So they also enforce laws and regulations that protect health and ensure safety, link people to needed personal health services, and assure the provision of health care when otherwise unavailable. So I know that for many years, when I first moved to Sheboygan, it was highly encouraged to go get your child's immunizations through the health department because they were giving them for free. I, as somebody who is working and having, insurance, I never felt comfortable doing that, so I would just take my kids to the doctor's office. But I thought that was really a great thing, that's just an example of getting people to get them health services when maybe it would be otherwise unavailable to them. It assures a competent public health and personal health care workforce, evaluates the effectiveness, accessibility, and quality of personal and population-based health services. Research for new insights and innovative solutions to health problems. So providing a population-based care is kind of a shift in thinking. So again, we are using the same nursing skills that you would in any area of nursing, just applying them a little bit differently. So we do have to think, though, a population is not homogeneous. So everybody in a population isn't the same. You really have to address the needs of special subpopulations. So that could be immigrant groups, it could be people of a different ethnicity that might have some specific health care needs. It could be people that have certain types of disabilities. We always have to think about that everybody in a community isn't the same. High risk and vulnerable subpopulations must be identified early in the care delivery cycle. So people that would be at high risk, we want to definitely attach our efforts to them in a very important way first. Non-users of services often become high-cost users, so people that don't go to the doctor's office, they don't go for any type of screening or preventive health care services. They may only go when something is a crisis, and then they become a high-cost user because more than likely they're going to the emergency department, and that is much more high cost than going to for a regular doctor's visit, or nurse practitioner, whoever the healthcare provider is. So it really is important to develop outreach strategies and try to reach people that are non-users. And we have to think about the quality and cost of all healthcare services. Are they linked together across the healthcare continuum? So, prevention versus cure. So, this is just part of that whole aspect of what nurses do. So, nurses really truly are more involved in the prevention aspect. So, we can think about medical care as really focusing on cure. So, physicians, possibly physician's assistants, possibly nurse practitioners, but I still think if you have that nursing background, we really are very focused on prevention. So cure is we spend additional dollars for cure in the form of healthcare services, and that does little to improve the health of a population. We really should be spending money on prevention. That does a great deal more to improve health and decrease the dollars spent on cure. So I think that really does make quite a bit of sense. So trying to work on that prevention aspect rather than wait until the person is very sick and needs high cost care. So nurses really are good at prevention. So we should always, no matter what area of nursing you go into, it doesn't have to be public health or community health that you're into, but we always should be thinking about prevention. Healthy People 2020. So when you're working in public community health, we're thinking about Healthy People 2020 goals. Now, it's 2019, so that means the goals will be coming to an end very soon, and I don't believe, I looked the other day, I don't believe the new goals for Healthy People 2030 are developed yet. They are definitely working on those, and those should be published, I would think, in the next few months. So, but right now, we are still working on Healthy People 2020, and we are thinking about the vision in which a society in which all people live long, healthy lives. Of course, that sounds like a very optimistic goal, but certainly why not aim for a goal like that? And at least if most people can live a long, healthy life, that would be probably better than, better than it has been. So we have overarching goals: high quality, longer lives, free of preventable disease, disability, injury, and premature death. I really think the word that is the most outstanding in that sentence is preventable, because we all know there are things that aren't preventable. There are some people get cancer or heart disease or other types of illnesses in spite of all their best efforts. So, but if there are things that are preventable, it would be wonderful to try to work on those so that, again, people don't just live longer, but actually live a healthy life longer. We are thinking about a goal of achieving health equity, eliminating disparities, and improve the health of all groups. So there definitely are groups that don't have as high quality access to high quality health care as other groups do. So just to try to eliminate that and get health care to all people. It shouldn't be just people that are wealthy that can afford, the best doctors that should get the best health care. Basically, that's what that's saying. We need to create social and physical environments that promote good health for all. So certainly focusing on environmental aspects is something that nurses need to think about. Promoting quality of life, healthy development, and healthy behaviors across all stages. And there are 42 focus areas, and I did not put those all into PowerPoint slides because there's a lot. So 42 focus areas ranging with basically every single health issue that you could possibly think about is included in those focus areas, and maybe you've seen those before in other courses. So the 3 levels of prevention, we're also thinking about that quite a bit now that we're thinking about community public health: primary, secondary, and tertiary prevention. So primary prevention is prevention of problems before they occur. So the person that you're focusing on or the group that you're focusing on is healthy. So it's health promotion and health protection. Secondary prevention is early detection and intervention. So pick up on it as quick as you can, find it early, and treat it so that that person returns to their usual state of health. So early detection and intervention, early diagnosis and treatment. Tertiary is correction and prevention of deterioration of a disease state. So in other words, the disease state is it's there. It's probably not going to go away. However, you can try to maximize that person's potential and their ability to live a functional life as much as possible, considering that disease state. So think about somebody who has been in a motor vehicle accident and now they're a paraplegic. So tertiary prevention would really focus on trying to get that person to be as independent and functional as possible. So, we want to limit disability and rehabilitate people again to the point where they are more functional in their lives. I did make PowerPoint slides on these different examples because I do think that this will help you a lot. I do have some test questions that talk about the different levels of prevention, so I really think that looking at these examples will be very helpful for you, because I know that it's easy to think that we understand the levels of prevention, but then sometimes when you see a test question, it's really a little bit more vague than maybe you thought it was. But anyways, and not that I would purposely make anything vague, but it's just sometimes there's even a little bit of crossover too between some of the levels of prevention. But honestly, I will try very hard to make sure that the test questions are pretty much good examples of primary, secondary, or tertiary. So, and this is, we're thinking about the individual. So these are examples of primary, secondary, and tertiary for the individual person. So some really nice examples for you there. Levels of prevention for the family. So primary, secondary, and tertiary, again, some different types of examples for each. I'm not going to read those all to you. I think that you can probably do that. And then for a group, levels of prevention for a group. So again, primary, secondary, and tertiary examples applied to groups of people. So hopefully these examples will help you just to understand those concepts just a little bit more. And now to the community. So we're thinking about a community, and primary, again, secondary, and tertiary applied to the entire community. So again, I do think that I will ask you some test questions on this. I do think these examples will be very, very helpful for you. So, all right. Chapter 6 now, community assessment. So the nature of a community. So an aggregate, again, is a community composed of people who have common characteristics. For example, could be senior citizens, could be different ethnic backgrounds, religious organizations. Again, an aggregate could be LTC students, nursing students. The community of solution is the common problem that unites individuals. So sometimes there is something that a community might be working on, and people rally together to try to find something that will help be a solution to that problem. So a community, we have to think about the community as having a location in space and time. So the physical location is delineated by boundaries and influenced by the passage of time. So things in a community aren't static. They don't stay the same. I'm always reminded of this when I go back to my former hometown of Rochester, New York, which I'll be doing soon. And I go back there, and there are so many changes that happen in that community. Just buildings torn down, new buildings going up, restaurants closing, new restaurants opening, new healthcare centers opening, expansions on the hospital that I used to work at. Everything is influenced by the passage of time. There's always changes that happen in a community. Census tracts subdivide larger communities. So when they do a census, then they are looking at very specific areas. Geographic community can encompass less formal areas that lack official geopolitical boundaries. So then you have the social system, and that's the interrelationships of aggregates fulfilling community functions. So it's basically how people are living and working together. So just a diagram of assessment parameters. So we have to think about the physical environment, and there's a little picture of a tree. So, what type of environment are we thinking about? There's lots of different types of environments. There's urban, there's rural, there's everything in between. There's suburban, there's areas that are more remote, there's areas that are more populated. So education, what's the basic education of people? What safety and transportation services and issues are there? Politics and government. How active are people in politics and government, and how does that influence the community as a whole? Health and social services. Is it an area that is, again, really remote and doesn't have very many services? People have to travel quite a distance? Or are there health services that are easily accessible? Communication. Are there communication issues? I guess I'm always reminded too of the importance of communication when I'm in a place where I don't get good internet access and I am not able to, use my cell phone. I'm not able to use my computer because I'm not getting a good connection. Economics. Is it a rich area? Is it an area that's moderate? Is it an area that's really poor and there's not a lot of monetary resources? And then recreation. What is available? Is recreation promoted? Are there safe places that our children and adults can engage in recreation? So again, all of these things are things that we need to be looking at. Disaster programs also, there wasn't anything about that on the little circle that I just showed you. Religion, education, yeah. Okay, so I'm going to go on to the next slide. So Healthy Communities is a movement to help community members bring about positive health changes. So Healthy Communities is part of Healthy People 2020, and we have to think about the interconnectedness between people and the public and private sectors. That's essential to make any kind of changes. So I don't know if anybody's ever been involved in trying to make a change in the community, but it certainly is not an easy process. Again, just serving on that heroin committee, it really took a long time, a couple of years before any type of action was created. So we always have to think about how, change is a very, very slow process. So, but the goal would be to have a healthy community. And each community has its own unique perspective. So just the two pictures even on this slide. The top picture looks like it's in a beautiful mountainous area and it looks very healthy. You see a lot of green grass and trees and mountains, so you're thinking fresh air, but also think about how far apart, there's some houses, some like clusters of houses, but basically what services would they have in this area? Are they far away from most services and hospitals and clinics, things like that? So you do have to think about which do you prefer? As a person, do you prefer living in an environment like that, or some kind of a farm environment, any type of area that is more remote and less populated? Or the bottom picture shows a city and what types of services, what types of recreation, what types of entertainment would be available, just all different types of things that are just different from these two. These are two very kind of a stark contrast communities. But think about perhaps the negative aspect of the bottom picture. So if you live in a larger city, there's many times crowding. People are living on top of each other. Not much green space, not much opportunity for being outdoors and being able to exercise, take walks in a safe area. It really depends, of course, on the city. But also think about pollution and smog and things like that. Sure doesn't look like there's much pollution in that top picture, so it looks just very serene, peaceful, and healthy. But we always have to look at different communities and think about, I guess, truly both the positive and negative aspects, and that truly every community is very unique. So assessing the community. So when we're looking at assessing a community, The windshield survey is certainly a great way to do that, and that is used to make organized observations of the area and its people. So, and that is an assignment that you are all going to be doing. So I do think that it's a very helpful way for you as nursing students to look at a community and look at it through the eyes of a nurse. Think about what are the good things about this community, what are the services and health-related issues that this community has, both positive and negative, and really think about, what would make this community healthier? What would be helpful? Should they have more parks? Should they have more green space? Should they have better transportation system, like a bus system, so that people who don't drive can get to their appointments? So just kind of some interesting ways to look at your community. And actually, because I really did find a lot of windshield surveys out on the internet on YouTube, and I have talked to several people in bachelor's and master's degree programs, and actually many colleges have students do windshield surveys as part of their public health learning. So it really truly is a very good assignment for you to do. So again, always helpful to think about your community as far as how would I like this community to be, maybe to be a little bit different. What are some things we could do differently? Maybe some of you will be so interested in this that you'll go into public health. It wouldn't surprise me if a few of you wanted to do this area. And I know some nurses that I know personally that have gone into public health have started out in acute care and then just really thought they would enjoy being able to impact greater groups of people, larger groups of people. So anyways, the one thing I want to say about a windshield survey is that I really didn't know what this was years ago when I was a student. I don't think we ever talked about this, but I actually took an informal windshield survey, and I didn't really know I was doing it at the time. So maybe some of you have had this experience too, where you've traveled somewhere and all of a sudden you're in a place where you're like looking around and saying, oh my goodness, what am I doing here? This doesn't look like a very safe place. So that happened to me when I was in Baltimore in the summer between my junior and senior year when I was in nursing school. And I decided I wanted to go see the Edgar Allan Poe House in Baltimore. So I found a map. Yes, we didn't have GPSs in those days. I actually had a real paper map, and I found out where it was, and I drove to the location. But as I was driving closer and closer, I really was starting to get very uncomfortable. There was a lot of buildings that were boarded up. There were people kind of lurking on the streets, just standing there watching and kind of looking at you as you're driving in your car, and just kind of like thinking like, who is this stranger in our area type of thing. At least that's the vibe that I got. And so I pulled over to the curb when I got to the Edgar Allan Poe House, and as I kept looking around, I really realized this is not a good area, and I really shouldn't, as a young single female all by myself, decided, nope, I don't think I want to get out of the car. So I actually drove away without even going inside and seeing the Edgar Allan Poe House. Anyways, and I've been to other places too where all of a sudden you realize, oh my goodness, this is not a safe place to be. So maybe some of you have done that too. You can drive or walk, and it is helpful to locate possible areas of environmental concern through sight, sense, and sound. So you're looking at the layout, the geographic features, the location of agencies, services, businesses, and industries. So another thing that community public health nurses look at is census data. So that helps the nurse become familiar with an area and see how it has changed over time. Every 10 years, the Census Bureau undertakes a massive survey of all American families, and metropolitan statistical area, central city with more than 50,000 people, and that includes the associated suburbs or adjacent counties, which yields a total metropolitan area with more than 10,000 people. So what's important about this? Back to the first bullet point. Helps the nurse become familiar with an area and see how it has changed over time. It's helpful to know what groups of people, what ages, what ethnicities are in your area so that you can try to help form policies that will be helpful in the promotion of health for all people. Vital statistics is something else that public health nurses, community health nurses look at. So that is the vital statistics is the official registration records of births, deaths, marriages, divorces, and adoptions. And so it's reported by local and state agencies, and that is compiled annually. Other sources of health data, the National Center for Health Statistics gives us local, regional, and state government reports. We have locally generated data collection, and the analysis of demographic information provides descriptive information about the population. So again, you're going to be looking at statistics for the discussion question and also for the community, the one-page community paper. You'll also be looking for statistics. So nurses who work in public health especially love statistics, and we do have to look at those because it helps us to realize what issues there are, and it helps us to focus our efforts. So the nursing process, of course, we always use the nursing process in anything, and of course public health and community health is no different. So we're applying the nursing process to the community as our client. So we do a needs assessment, we diagnose problems, we plan, we intervene, and we evaluate. They do a community needs assessment every few years, and I know they just did one fairly recently in Sheboygan. And then once they do that needs assessment, they come up with a community health action plan. And then they have a very formalized, written, detailed plan on different health issues in our community and what they're going to be doing about them. So in a needs assessment, we're identifying the aggregate for assessment, we're engaging the community in planning, identifying required information, selecting a method of data gathering, developing questionnaires or interview questions. Sometimes that can be difficult, to really get people where they're at. A lot of times nobody hardly at all has landlines anymore, so calling people on their cell phones, how do you get people? Mailing them questionnaires. So many times people throw questionnaires in the garbage or recycle bin, whatever. So it can be kind of hard to get people to interview them and actually collect that data. So that can be a challenge. They develop procedures for data collection, train data collectors, arrange for a sample representative of the aggregate, conduct the needs assessment, tabulate and analyze that data, identify needs, and develop that action plan. So again, makes me think about what they do in Sheboygan, and I'm sure in Manitowoc, as far as that developing that community health action plan. So you have to start with identifying, and you work all the way through the different parts. I have in green, I think those two most closely relate to assessment. The blue is kind of planning. The red is really part of evaluation, and the black, developing that action plan, that's where you're going to base your interventions from. So this is a format for a community health diagnosis. So again, very similar to what you would do for an individual person. So we could make one up and say increased risk of tuberculosis among, let's say, the Hmong population related to exposed to tuberculosis in their home country, or possibly another related to could be using tuberculosis medications in an inappropriate way. And actually that is something that a public health nurse told me about, basically that sometimes isoniazid, which is a TB medication, is sold at public markets, farmers markets, and that people use that for lots of different issues. If they don't feel well, they'll take this medication, and it really is specifically for tuberculosis. So if you take that medication, then you get drug-resistant strains of tuberculosis. So anyways, a little bit of a complicated related to, but the demonstrated by or evidenced by would be perhaps 3 new cases of tuberculosis this year. So as you can see, just wanted to give you an example of how you would use the same format for nursing diagnosis, perhaps to diagnose a community. All right, Chapter 7, Community Health Planning, Implementation, and Evaluation. So the community health nurse is really in the middle of all and interacts with all of these different aspects. So the community is our client. So again, assessment, meet with group leaders of the aggregate to clarify mutual expectations. We have to determine socio-demographic characteristics. Who is in your community? It's really hard to plan anything and work on the health of a population if you don't know who is in your community. Interview with a key informant. So who knows, who has the information in your community that would be really valuable? We have to consider both positive and negative factors, compare the aggregate with the norm, whatever the norm might be, research potential problems, identify health problems and needs, and the community involvement is really essential to doing any type of intervention in the community. We have to start where the people are at. Get people where they're at. Same principle, really, if you think about it, when you're doing any kind of health teaching or health promotion for people that are your patients in the hospital or in the nursing home, start where they're at, and then we have to hopefully build on that. So the nurse is going to be prioritizing the identified problems and needs to create an effective plan. So of course, again, we always start with assessment. So factors that determine our priorities, the preferences of the groups, the aggregate. So what do they prefer? We can't force people to do something if it is not part of their thoughts and ideas and values. So we have to determine those preferences. We have to think about the number of individuals affected by the health problem. So it wouldn't be a really good idea for a nurse to come up with some wonderful plans and interventions if there really aren't very many people affected by a particular health problem. So we have to look at the severity of the problem or need, availability of potential solutions. You know, we don't have an enormous amount of resources. Every community has a finite supply of resources. There isn't an enormous amount of money out there. So, you know, we really do have to take that into consideration. Also, other practical considerations, skills, time, available resources. Again, we may use Maslow's hierarchy of needs or Level and Clark's levels of prevention to further refine our priorities. So this is all part of the steps in the health planning model. So assessment and then planning, we have to determine the intervention levels, think about primary, secondary, or tertiary levels of prevention, and then validate the practicality. Is this practical? Is this realistic? Knowing what resources that we have available. So developing goals and objectives, again, just following right along with the nursing process. The goal is where we want to be, and the objectives are the steps needed to get there. You've probably heard the acronym. I hate acronyms because I think we have too many of them. But anyways, SMART goals. So this is kind of a specific, measurable, attainable, relevant, and timely. So those are all things that we should really be thinking about when we are making goals. And then our interventions, that's the most enjoyable stage for the nurse and the clients. The implementation should follow the initial plan, should include a variety of strategies. And we always have to prepare for unexpected problems and consider using all types of media to disseminate information. I do think that last bullet point is really important because there is so much information out there at our fingertips that's already developed. And so we don't always need to come up with something from scratch. It's oftentimes a good idea to research what's available already on the internet and perhaps use that or use that as a basis and maybe refine it a little bit. But there's so much information out there. Of course, we have to be careful about information that is really good information versus something that really isn't very scientific or accurate. And then, of course, the evaluation. The important component of success or failure of the project, so is evaluating it. Very, very important. Includes the participants' verbal or written feedback on the nurse's detailed analysis. It should reflect on each stage to determine the plan's strengths and weaknesses and communicate follow-up recommendations. So again, same thing you do when you're thinking about evaluating a patient's response to your goals. So it's just applied in a little bit more of a broad way. So the importance of each step in the nursing process, aggregate assessments have to be thorough, should elicit answers to key questions about the aggregate's health and their demographic profile, should compare this information with similar aggregates presented in literature. And the nurse must complete careful planning to set goals that the nurse and aggregate accept. Mutual planning is very important. So anything I have kind of red and in bold, really, truly, I want you to pay attention to that and think about that as an overall concept. And especially it will be very helpful if you're thinking about when you're answering test questions. Think about some of these overall concepts. I know that the community-based learning plans might be a little bit harder to relate to because you haven't had a community-based or public health or community health nursing rotation. So it's maybe a little bit difficult to kind of relate. So think about that overall concept. So planning with the other person. And of course, that is something that you do with an individual patient too. If you have this wonderful detailed plan for what you're going to do to teach a patient and help them with a health issue, and the patient has no interest in that plan, such as quitting smoking, you're not going to get very far. So it's very much the same concept. Mutual planning, very, very important. So, and then again, the interventions have to include participation, and evaluation include the process and product evaluation and the input from the aggregate or the group. The nurse's role is to work collaboratively with health planners to improve the aggregate health. So again, the health of that particular group. We have to fuse technology with knowledge of healthcare needs and skills, become directly involved in that planning, and engage in, again, aggregate level projects. So the changing focus of health planning legislation is heavily influenced by the politics of the administration in power at any given time. So this we really do have to think about. They give examples of the Reagan administration encouraged competition within the healthcare system. Clinton administration, they had a plan for healthcare reform, which included mechanisms to revitalize planning at a national level, but that failed, and in 1994 gave planning back to state and local agencies. So as nurses, we really do have to think about the what's going on in the government and how is that affecting healthcare. The Affordable Care Act reduced premium costs for millions by working families, and small businesses by providing tax relief, capped out-of-pocket expenses, required preventive care to fully be covered without out-of-pocket expenses. No pre-existing medical conditions were denied service. And again, we don't know exactly where things are going with the Affordable Care Act. This slide sounds very positive. However, in talking to people and even students, there have been times where people have had difficulties even with the Affordable Care Act. And so it's really been a challenge for our country to try to come up with a solution to this problem that we have. So as nurses, we just really have to be aware of what's going on and try to advocate as best we can. Chapter 9, Case Management. So, an overview of case management. So, that is a way for nurses really to act very collaboratively as far as a role that's based on looking at individuals, groups, and health. So that's why we're kind of talking about it here. So it's an intervention strategy for quality improvement initiative. So again, think about QSIN, and quality improvement is part of that. It's a collaborative process of assessing, planning, facilitating, care coordination, evaluation, and advocacy for options and services to meet the individual and family's comprehensive health needs through communication, available resources to promote patient safety, quality of care, and cost-effective outcomes. Okay, I get it. That is a mouthful. So we'll talk about those things a little bit more as we kind of break things down. But yes, that's a very heavy definition. So basically, we're aiming to provide a service delivery approach to ensure cost-effective care, alternatives to institutionalizing people, access to care, coordinating services, and improving the patient's functional capacity. So those are really some very basic goals that we're thinking about. The purpose, client-centered, it helps the client through a complex, fragmented, and often confusing healthcare delivery system to achieve specific client-centered goals. And it's very system-centered also because it recognizes that resources are finite. We don't have just an enormous amount of money and resources available, so try to use them as wisely as possible. And again, promoting cost-effective but also high-quality care. So those two terms should not be mutually exclusive. We should not have, think about cost-effective care as substandard care and poor care. It should be as high quality as possible, but also cost-effective. The person who really is most in need of case management would be people that have complex multiple healthcare needs, because many times they not only go to their primary care provider, whether that be a physician, nurse practitioner, physician's assistant, whoever that is, they may also see quite a few different specialists depending on what's going on. They may see an endocrinologist, they may see a rheumatologist, they may see a kidney specialist. They may see many different people, and so coordinating all of their care and medications can be sometimes very challenging. So usually it's the person that we think about needing case management as having complex healthcare needs, not somebody who has just, maybe a little high blood pressure and they're on a medication. That person wouldn't necessarily need a case manager. So care coordination. So it really targets chronically ill people at risk for adverse outcomes and expensive care. So identifying that full range of problems that increases the patient's risk of adverse health events, educates in self-care, optimization of treatment, and integration of care. Very, very important. That educating people in self-care, hugely important. Many times people do self-care anyways, but they may be getting self-care off the internet and Dr. Google. So people refer themselves and just kind of look things up and try to manage things on their own, and that isn't necessarily the best thing. So we really need to educate people on what is actual, effective, scientific-based self-care. We want to be monitoring patients for progress and early signs of problems, and we hope to raise the quality of care, improve health outcomes, and reduce the need for costly hospitalizations and medical care. So those are some basic goals. The referral process. In the acute care hospital setting, usually it relates to the patient diagnosis, so whatever their diagnosis is might trigger the case manager to become involved if they have an extended length of stay or if they're re-hospitalized. So if they have CHF and maybe some kidney issues and diabetes, they have extended lengths of stay, and then they are stable, and then they come right back in maybe within a couple of days. They keep having repeated hospitalizations. That can certainly trigger a case management referral, because something isn't going well when they're being discharged and when they're at home. So really to try to get them to stay out of the hospital and to stay healthier. So the tools used to identify people who benefit from case management: health risk screening tools, evidence-based criteria, risk stratification through data management, referrals from hospitals, healthcare providers, and families. So a couple of different ways. We can have disease-specific case management, so individuals with medical conditions that are high cost, such as cancer. Cancer is very high cost. Some of the medications, especially if there's a new medication, many times it could be thousands and thousands of dollars per capsule, per dose, per week, per day. So we really sometimes are looking at very, very high cost treatments. And maybe some of you know friends or family members that have high cost conditions, and sometimes it's just horrifying to see the amount of money that that their treatments are costing. So other examples that they give, chronic obstructive pulmonary disease and congestive heart failure, again, are two diseases that can be very high cost, and people seem to be cycling in and out of the hospital quickly. So again, the goal: keep individuals as healthy as possible and stable in their home environment. So again, I know some of this again is very hard to relate to, but if you think about things, I should have maybe put that in red, because I'm trying to bold things in red here and there that are kind of important. But this really is just an overall important concept to think about. So, and we really were talking about case management with this learning plan because that's a very important aspect to keep people in their community and in their home environment. There is case management in behavioral health, and it can be very, very important. In the 60s and 70s, mental health care emphasized moving patients from mental health institutions back into the community. So that was called deinstitutionalization, and Congress acknowledged that disabled people had been deinstitutionalized without basic needs, proper follow-up, or any health care monitoring. So many of those people did end up getting referred back into care. They ended up being reinstitutionalized or hospitalized because they did not, the policy just didn't follow to provide these people with any kinds of resources. So they further recognized that you needed a systematic approach to service delivery, and that could have prevented many state hospital readmissions. So just a little example of kind of a failure of, it sounded like a great idea to have people not be in institutions for many, many years, because some people were in institutions for 20, 30, 40 years. Great to integrate them back into the community, but truly needed to have some services in place. So it was good that the government recognized that. So I just had to give a little mental health example. So primary care, chronic care management, high-risk settings provide services to high-risk clients such as perinatal clients, transplant, so especially high-risk perinatal clients, I should say, specifically people that may have just gestational diabetes or perhaps pregnancy-induced hypertension, some things that are very, very high risk, or perhaps they have a health issue. Maybe they have multiple sclerosis and now they're pregnant. So it could be many different issues. People that have transplants, dialysis patients, and certainly, again, cancer patients. So those would be some very typical people that would need those types of services. So case management and community health, it can occur in public health clinic settings, in occupational health settings, and high-risk clinic settings. So again, clients with complex chronic diseases and home health and hospice. So case management is really very much something that is very integrated in all of these aspects of care. I believe that in intermediate clinical that you get to spend some time with a case manager during your med-surg rotation.
Unfortunately, we can't do that during the mental health rotation only because there are only 4 days of clinical for mental health. But we certainly have case managers available, and actually it would be great if you see them on the unit just to have a little interaction and conversation with them, because they will definitely tell you some very interesting stories about trying to work with patients and to get them the care and services that they need. Okay, I haven't really told too many stories yet. So one little story I do have to share about talking with one of the case managers on mental health was that they really advocate for the patients to get the care and services they need in the hospital. So this one patient was extremely ill, probably one of the sickest young men I have ever seen in my life, had not been eating or drinking anything at all, very, very psychotic, had a lot of very dangerous behaviors out in the community before he was brought into the hospital. So he was not eating or drinking anything. It was really a challenge to get him to take anything, to take medication, to take a sip of water. Huge nursing challenge. And the insurance company was trying to tell the case manager that he had a simple depression and that he should be treated at home. So, and the case manager was just absolutely livid, because here this guy was extremely sick, and he was becoming physically ill also, because when you don't eat and drink, of course, you have physical problems that develop. And so she really had to advocate and go to bat for this person so that he could receive insurance funding for him, because his symptoms really were extremely severe. It was not a simple, I don't know how they got that impression, but that it was a simple depression, or a simple depression that could be treated at home. That was absolutely not accurate at all. So anyways, just an interesting overall thinking about case management and the impact that a case manager can have. So case managers have to have appropriate educational background. Usually they are going to be have a bachelor's degree in nursing. A minimum skill level is needed to ensure success in the role. Usually they have to have some clinical background also. So they have to have some actual nursing experience. It would be a difficult job to go right from school to being a case manager without having that hands-on experience yourself. There is certification available also, so you can have some extra credentials added to your name. Some of you may be interested in this in the future. Okay, and the last part of this learning plan, you know what, I think I'm going to stop and start a different recording, because I noticed this one's over an hour already. So we're going to be talking about roles of nurses in community settings.